name is Steven Deborah Abiyoku, a 200 level nursing and healthcare management student of the Joint Profession Training and Support Institute JPTS Center in collaboration with South American University USA, Global Wealth University Togo, and American College, California. I'll be presenting a brief seminar on the terms attitudes of nurse towards relapse prevention among psychiatric patients in Federal Neuropsychiatric Hospital. The problem of every hospital when the targeted objective is not achieved. That is, there is something wrong either with health caregiver, the patient, or the general public. In order to improve the standard of health of the patient and keep them progressively fit. The reason why such labs are presented here to be suggest and the reminder made in order to achieve the set objective of the hospital. The study is based on the attitude of nurse towards relapse prevention among psychiatric patients in Federal Neuropsychiatric Hospital. The aims and objectives of this study are all directed towards bringing out lasting solutions to curtail the myths, and it also intends to actively inform the management of the hospital, especially on employing new and scientific approach to holistic patient care. The instruments used for data collection were from interview and questionnaire, which were represented in tabular form, bar charts, pin charts, and percentage notes were used for the study. The data collection were analyzed. The results showed that many factors contribute to the effects of all this can be prevented through adequate education, family-oriented, and following up appointment. Psychiatric analysis has facilitated and confident health scientists and philosophers for centuries. Its impulses have been attributed to precision by Diamond, considering to be punishment by the gods for the evil done and acceptance as evidence of the inhumanity of its suffering victims. This explanation resulting in enduring stigma for those who were diagnosed with such disorder. Even today, much of the stigma are demonic or true. It has less to do with demonic possession than with scientists' unwillingness to show that the treatment cost association were monitoring illness. Before I conclude, I would like to define the terms. Attitude is the way you think and feel about something. Nurse is a person whose job is to care for people who are ill. Psychiatric patient is a person who suffers from mental illness, which could be minor, major. Relapse, this return of disease after an interval of analysis. Conclusion: have about a day or 2 days journey distance to the hospital, resulting in poor monitoring and accessibility to the mental health service. Other factors also include stigmatization and dependency on caregivers. All these have contributed in the frequency of relapse experience in the care of this group of patients leading to the social disability. Thanks.